Hi, my dear friend, good morning. My name is Dr. Gaurav Chawda. You can call me Dr. Gaurav. So, how are you all today? And let me introduce a very important and a very precious topic, PCOD, or you can call it PCOS. When I'm speaking regarding PCOD, the full form is polycystic ovarian disease, and when I am telling about PCOS, it is a polycystic ovarian syndrome. In both terminology, the difference is that in one terminology there is a syndrome and second it is a disease. So let's start. So what is the PCOD? To know that, first of all, we have to know what is the age limit for PCOD and PCOS. So from 10 to 11 up to 50 years, you may see a case of PCOD in women. It may be unmarried, it may be menarche, it may be fertility period, or it may be menopausal or a postmenopausal woman. So all these age group are affected by PCOD and PCOS. So how PCOD represent? Basically, there is a amenorrhea, absent period. Second is infertility, not conceiving child. Third one is there is an irregularity in the period, in the mean of there is a no period for 3 to 4 months followed by heavy bleeding, or there may be spotting. There may be chances that menses only come after there is a withdrawal drug or any medication. PCOD associated with thyroid disorder, hypertension, diabetes, and there may be, in rare cases, there may be endometrial hyperplasia or endometrial carcinoma. So this is a group of disorder combined together known as the PCOS. Now, how we can detect the PCOD or the PCOS? To know that, first we have to understand what is the basic anatomy and what is the physiology of the reproductive trait in female. So for that purpose, first of all, we know that one truth, for conceiving a child, 50% male partner is responsible and 50% a female partner is responsible. Now please keep apart the causes of the male infertility. We just talking regarding PCOD part of the female and only female reproductive trait. To conceive a healthy baby, a female must require a vagina, a cervix, a cervical canal, uterine cavity and uterus, both fallopian tube and ovaries. But the disease is only like present inside ovaries, so that is the pathology is always happen inside ovaries. Normally, during first 10 to 20 days in female menstrual cycle or ovulatory cycle, follicle develop in each ovary or in alternate ovary in the form of 3 to 4 follicles. But in case of PCOD, there may be more than 20 or 10 follicles in each ovaries, and there is a fat layer surrounding the or stroma layer surrounding the ovaries, and which lead to non-ovulatory cycle, or there is no follicle growth, or there may be delayed growth, or there may be problem in ovulation, ovum separation. So which lead to there is no meeting part of the female ova and the male sperm in the apical region of the test tube, in the fertility tube. So what happened that will lead to the secondary amenorrhea, or there may be an infertility. And of course, in some cases PCOD with an obese patient, and in some cases it may be in lean patient. So when patient present to the hospital in the form of complaining of secondary amenorrhea, there is DUB, in the sense of there may be irregularity in the period, and there may be complaining of not conceiving the child, or there may be like a 1 month, 10 day, 20 day, 5 days without pregnancy. In urine test it may negative, in beta HCG also it is 0. So these are the most common like presentation with PCOD. So what is the treatment part of the PCOD? In past, doctor advised for like healthy diet, low fat diet, and more vegetables and fruits with regular exercise, and also some brisk walking and healthy lifestyle. But when the PCOD is more than 5 years, there may be chances that there is a conservative treatment may fail, and patient must take a treatment for PCOD. So doctor should always advise a right treatment for the PCOD for the more than 5 years. So in those cases, we always recommend IVF ICSI treatment whenever required. So what happened? During the IVF treatment, we just give more recombinant FSH or highly purified HNG. So follicle will be growing, and during this period we are doing serial of like ovulation study, and then we do pickup, and in PCOD we always recommended freezing. After that, in next cycle, in natural cycle, we transfer embryo. So that lead to the success of the IVF. So this is a brief information regarding. With this, my dear friends, I complete PCOD introduction. If you have any question, you can feel free to ask me. And thank you so much for kind and with quite hearing. So if you have any problem, you can just call on number 9974864644, or you may direct come to the hospital for visit. Hospital address is MADHUDEEP IVF and Test Tube Baby Hospital, Parvati Chowk, opposite Pilgari, near ST bus stand, Bhavnagar, Gujarat. And we are ready and happy to help you to treat PCOD. We are doing regular OPD in the morning, in routine hour 10 to 12 in the morning from Monday to Tuesday. You should take appointment before your treatment. And behalf of MADHUDEEP IVF and Test Tube Baby Hospital, I am Dr. Gaurav Chawla and my colleague Dr. Alpa Chawla, always ready to help you. And our best regards for the PCOD patient. And we must fight this disorder because it is a epidemic, and maybe within few years it will be pandemic. Jai Hind, Jai Bharat, Vande Mataram.